COVID-19 is defined as illness caused by a novel coronavirus. This pandemic has spread to 180 countries, claimed more than 83,000 of lives. This brings floods of people to the hospital all around the world and increased the workload of healthcare staff. However, most of the countries are using artificial intelligence in various of ways into the healthcare system in order to combat the coronavirus and also minimize the workload. So in this video, we will explain more about how artificial intelligence can help during COVID-19 outbreak.
The first example is Boy Health. Boy Health is an intelligent system checker. It is an AI-based symptom and cure checker that uses algorithms to diagnose and treat illness. Boy Health has a chatbot which listens to a patient's symptoms and health concerns, then guides that patient to the correct care based on its diagnosis. Harvard Medical School is only one of the many hospitals and health that use Boy's AI to help doctors detect and treat quicker. To help with COVID-19 pandemic, Boy Health joined forces with researchers from HealthMap, a digital epidemiology tool developed by a team at Boston Children's Hospital led by John Brownstein in 2006. HealthMap has been working on tracking the novel coronavirus from the onset and has experience tracking the spread of diseases. Patients can get information about the condition. It may also be listed as a possible condition for certain patients based on travel history and other factors. This is how Boy Health AI is used.
Another example is Suki. Suki is a voice-based digital assistant that capable of filling out affected patient details and automatically add them to the electronic health record. Electronic health record is an electronic version of a patient medical history include progress note, medication and clinical data. During the crisis, Suki has come up with COVID-19 templates and data to speed up the note-taking process. This is faster and simpler than writing out the EHR manually. The doctor also can retrieve COVID-19 patient information without searching in the EHR, which can reduce time consuming. This is an example of COVID-19 template that Suki has come out. The template will contain patient details such as their name, date of birth, and date of survey. It will also show what symptom of COVID-19 that the patient had and the history of the patient, whether the patient has travel out the country or had a close contact with other COVID-19 patient, which there are the main reasons why the patient could be affected with this virus. The template will also show review of the system. Review of the system is an admission of our specific body system in order to know about the sign and other system perceived by the patient. The doctor can call Suki to a phone or desktop application by only use voice command. For example, Suki, write up a complete clinical note for this COVID-19 patient. Suki will capture the voice and begin the process. Suki also can record conversation between the doctor and patient, then it will convert the conversation into a proper format. This is example on how Suki look on desktop and phone application.
Okay, next we have QXR. Before I get started, let me explain to you briefly about it. So QXR is developed by a company named Cure.ai and it's originally used to generate chest X-ray interpretation reports, detect tuberculosis as known as TB, chronic obstructive pulmonary diseases, lung malignancies, and medical emergencies like lung collapses and cardiac disorders. The company has announced that it has developed additional capabilities for QXR that could help reduce COVID-19 induces burden on healthcare infrastructure. This can be used by healthcare workers for screening COVID-19 patients who need to undergo further testing as well as to monitor the progression of patients. So, how can this QXR help us with this pandemic? Firstly, we can do chest X-ray screening. Basically, screen chest X-rays for COVID-19 signs. So, QSR can detect findings like ground glass opacities and consolidation abnormalities that are indicative of COVID-19. Next, lesion localization and lung parenchyma with COVID-19 risk, and affected area estimate. Basically, it quantifies the proportion of lungs affected due to the lesions. Okay, moving on to progression monitoring. As we already know, COVID-19 patients need frequent monitoring. However, quantifying the extent of the infection is a time-consuming step for already overloaded radiologists, and the results are often inconsistent. This is where QXR can help. It can help monitor progression of infected patients via daily bedside chest X-rays, automated operate in seconds without burdening the radiology team, and lastly, estimates percentage area of the lung and tracts change with each chest X-ray. What I can conclude here is KSR interprets a COVID-19 patient's lung scans in seconds and quantifies how much of their lungs have been affected by the viral infection. This enables the time and resource-strapped clinicians to monitor disease progressions more accurately and efficiently.
The last example is InfoVision. InfoVision scientists and engineering team have successfully launched the coronavirus artificial intelligence solution specially tailored for frontline use to help clinicians detect and monitor the disease efficiently and effectively. InfoVision's deep learning medical imaging platform is helping screen patients for the coronavirus in China. It acts as second pair of eyes to identify multiple diseases from one set of chest scans. InfoVision also provides a complete view of the nodule, including volume and density. It has been in use at the center of the epidemic outbreak at Tongji Hospital in Wuhan, Tongji Medical College of Guangzhou University of Science and Technology, along with sites in other cities such as the Third People's Hospital of Shenzhen in Shenzhen City. InfoVision also improving the CT diagnosis speed for each case. It helps sites with limited medical resources to immediately screen out suspected coronavirus infected patients. InfoVision also helping manage the process efficiently, assisting with pneumonia marking, abnormal and severe case analysis, patient triage, medical resources coordination, prior case comparisons, and treatment assessments.
Healthcare organizations are in an urgent need for decision making and getting proper suggestion in short time. Therefore, AI will be an effective tool against these pandemics in many different ways.